Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and all my videos are directly referenced from the internationally accepted US National Medical Library, and that's why you can trust the information given in my videos. So today I'm going to talk about varicose vein. I have been asked various times about this topic, and that's why I will explain this topic in utter details. I've already made a small video, a short video of this topic in my FAQ channel. So if you haven't seen that, go and watch it. And this video is going to be a detailed video, so it would be a little longer one. So stay tuned guys, we're going to discuss everything there is to know about varicose veins.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So varicose vein is basically a swollen, twisted and enlarged vein. Something similar to a hemorrhoid, a Peil's vein, but in this case the vein is in the legs, right? It's a swollen, twisted, enlarged vein that you can see under the skin, just like what bodybuilders are looking for in their arms, etc., etc. But in this case it's in the legs, right? And these are often bluish or reddish in color, and as often as I said, they can appear in the legs, they can appear in the arms. So these are varicose veins, most commonly in the legs. Normally, how they are formed, see, for understanding varicose vein, you need to understand the difference between arteries and veins. Artery is basically the blood vessel which carries the blood from the heart to the tissues, to all your tissues, and veins are the blood vessels which carry the blood from the tissues back to the heart, right? So these veins actually have to carry blood against gravity, right? They have to carry blood against gravity from the legs. So that's why they have valves, right? They have one-way valves which actually allow the blood to go up, but when the blood tries to go down, it closes. So they have valves, one-way valves, right? So these one-way valves in your leg veins normally keep the blood moving only upwards towards the heart. But if the valves do not work properly, one of the valves or many of the valves don't work properly, what will happen? They will allow the blood to go back into the veins, and the veins will become swollen, right? Because of the blood collection. This causes varicose veins, right? Did you know that? So varicose veins are very common, and they can affect women more than men, right? But they do not cause problems, major problems in most people, right? However, if the flow of your blood through your veins becomes worse, that means flow is not coming up properly, the problems such as leg swellings, pain, blood clots, and skin changes can be there and can cause severe problems. Most of the time it doesn't happen, but this can happen. So how you will get this, who will get this, what are the risk factors? Right, first risk factor is old age. As you old, your valves can be dysfunctional, can be not functioning properly. Females, being females, your hormonal changes during puberty, pregnancy, menopause can actually lead to these varicose veins. And sometimes if you're taking birth control pills or hormonal replacement therapy, or if you have increased your diet or decreased your diet, so this can increase, right? Sometimes you might be born with a defective valve from childhood. Obesity, gaining a lot of weight, pregnancy can have increased risk of this condition. History of blood clot. If you already have a history of blood clot in your legs, then you might have this condition. If you are doing a lot of work while standing or sitting for a long period of time, if you are a bus conductor or some shopsman, sitting and standing for a long period of time can cause this problem. If you're not mobile enough, not active enough, then it can happen. Family history of varicose vein, obviously there is some genetic correlation of dysfunction of these valves, so family history will predispose you to a higher risk. So what will happen? What are the symptoms? See, when you have such dilation of the veins will obviously be full. They will feel heavy. they will ache sometimes. Sometimes there is pain in the leg. So painful legs, there will be visible swollen veins. There will be smaller veins that you can see on the surface of the skin. These are called spider veins. Small veins are spider veins, which are very common. They are not a problem. But if there are big vein, that is an issue. That is an issue, right? Most often thigh or calf cramps can happen in this condition because of blood pooling, and this can happen at night, right? Then you might have mild swelling in the feet and ankles. You might even have itching over these areas wherever there is so much of swelling. So if blood flow through these veins becomes worse, right? Blood is not coming up and all the valves are not working, blood is getting pulled down, vein is getting distended, it's getting irritated, right? There is pain. What will happen? The leg will become swollen, right? Then your leg or calf, right? Pain will be there after sitting for a long time. Skin above this will become discolored. It might get bluish, reddish, then it might get irritated, it might get dry, it might get scaly, right? Which can crack easily, right? Since skin sores like ulcers, they can develop over the skin which will not heal easily. Then thickening and hardening of the skin will happen in the legs because of the swelling and even the ankles. But this will happen over a time, over a period of time. If you don't do anything about this condition, if you ignore this condition for a long time, then this happens. So how will you diagnose? How doctors diagnose? Obviously, just by looking at it, we can know that there is swelling in the veins, and examination is the key here. Then changes in the skin or sores, these are the key. Sometimes we can check the blood flow in the veins, because deep inside your legs also there are veins, there are perforating veins connecting each other. So perforators can be checked through color Doppler, ultrasound, venous color Doppler. We can rule out other problems in the legs like blood clot by doing a color Doppler, right? So all these tests are done to check the whole picture. Okay, then coming on to the treatment, right? Obviously, the most important thing here is self-care. You have to do self-care because this problem has happened because of your own, weakness, your own weak valves, your own standing up for a long time, right? So you have to self-manage varicose veins first, right? First thing is to wear compression stockings. This is to decrease the swelling. Obviously, if you compress the vein from outside, right, the pressure from the stockings when you are walking or standing will push the blood up instead of veins which are dilated. So stocking is good. So then do not sit or stand for a long period straight. Stand up and walk, do something else, walk, lie down, change your posture every time, right? Even moving your legs slightly helps keeping the blood flowing, right? Raise your legs above the heart level 3 to 4 times a day for at least 15 minutes. You can use pillows, you can keep your legs up on the table, whatever you want to do, raise it above the heart level for 15 minutes, 3 to 4 times a day. Care for any irritation or wounds or any ulcers if you have them, open sores, infections. Don't let infections get settled. Don't let it get infected. That would be very bad, right? If you are overweight, lose weight. Cut down on your carbs. Go on a fruit diet. Whatever you want to do. Follow my weight loss diet. Go on a DASH diet. Lose weight. Right, get more exercise. This can help you, keep off the weight also, and it also helps the muscles, calf muscle movements, pushes the blood up from the legs. So walking, swimming, everything is good, whatever you can do. Okay, if you have dry or cracked skin on your legs, moisturizing needs to be done. Moisturizing is important. However, remember, some of the skincare treatments can make the condition worse. So you have to talk to your doctor before using any chemical induced lotions, creams, or antibiotics. Especially don't use antibiotics unless and until there is infection. Okay, then a very small amount of people, very small number of people who have severe pain, severe varicose veins, they might need some procedures. Especially if you are ignoring your varicose vein for a long time, then it becomes so huge, so big, the leg becomes huge, swelling. So you have to do something about the swollen veins. In the swollen veins, the idea is to actually, first thing we try is to shrink the vein. First we try saline water injection into the vein, or a chemical solution is injected in the vein. The vein slowly hardens and disappears. That means it goes down. That can be done. Then phlebotomy can be done. It's a minor surgical cut is made in the leg near the damaged vein, and the vein is removed. Vein is removed through the cut, one of the cuts, basically phlebotomy. The vein is removed, right? If the varicose vein are larger, longer, and more widespread all along your legs, then your doctor will suggest something else, like a procedure called laser or radio frequency procedure. In this case, the procedure can be done in doctor's clinic, doctor's office, doing obviously using a laser or a radio frequency ring. Then varicose vein stripping. Varicose vein stripping can be done, which is used to remove, right, or tie off a large vein in the leg. Sometimes like a superficial saphenous vein, right? Large vein can be stripped off or tied off, right? That is important because you cannot allow legs to pool, blood to pool down in the legs. That is very bad. So various procedures are there, and obviously all the procedures will have their own complications which you need to discuss with your doctor. Some procedures which are invasive will have infections, redness, irritations, allergies, all these anesthesia related risks will be there. But ultimately, pooling of blood because of varicose vein in itself is a very huge problem. I mean, it's a chronic problem, can have complications. So varicose veins tend to get worse over time. So you need to do self-care. If you don't, then you'll have problems, right? You have to manage your aches, your pains, right? Keep your stockings, always wear stockings. Keep your legs up. That all things, everything which I've said earlier, right? That's important. And if the pain increases, if things are getting worse, if sores or ulcers are developing, if you're having fever, redness in the legs, right? Go to a doctor. Go to a surgeon. The best doctor is a surgeon, general surgeon. Or you can go to a plastic surgeon. So this is all about varicose veins, varicosities, which you need to do. There is nothing more, nothing else which is there. Remember that this can be treated very easily with a number of treatments, injections, lasers, phlebotomies, right? And ablations can also be done. Ablations are used, intense heat is used to treat the vein. In these, there are basically two methods. One is a radio frequency energy is used, and the procedure will basically, the doctor will puncture your vein, and the doctor will, will thread a flexible tube, catheter inside the vein. The catheter will send intense heat signal to the vein. The heat will close off and destroy the vein, and the vein will disappear over time. Ablation can be done. So a lot of procedures are there. Talk to your doctor what procedure, if you need the procedure or not. So, or else manage with self-care all the tips which I have given. Don't forget that this condition is because of standing for a long time. So first clear your base, right? That's all about varicose vein there is to know. So I hope you liked the video. Don't forget to share this video with everyone in your social network, and don't forget to subscribe and hit the bell icon. I'm Dr. Paramjeet. I'm a consultant physician and cardiologist in Yashoda Super Speciality Hospital in Nehru Nagar, Delhi NCR, and you're watching my videos on doctor education. Stay connected with me, guys. This is where you get authentic, simplified education free of cost. Till next time, stay connected, stay healthy.